The cost of healthcare in the U.S. without medical insurance. Hello everyone. Hospital costs depend on the hospital where it is, the patient's insurance coverage, and more. They can vary wildly. The average per-day hospital cost in the U.S. is $2,883, with California $4,181 the most expensive, and Mississippi $1,305 the least. The average hospital stay is 4.6 days, at an average cost of $13,262. Many factors figure into hospital pricing, including an individual's health circumstances, the cost of lab tests, X-rays, surgical procedures, operating room and post-surgical costs, medications, and doctors' and specialists' fees. Surgery costs can cause the price of a hospital stay to skyrocket and varies with the type of surgery and other factors. These are average American healthcare prices for common procedures and services. The average cost of an emergency room visit. The average cost of an emergency room visit without health insurance will vary depending on the facility and services used. If you visit the emergency room without insurance, you could end up paying that entire amount or more yourself. You're better off going to an urgent care center or elsewhere for treatment, rather than the ER, unless you're dealing with one of the following: broken bones, chest pain, head or neck injury, serious burns, stroke symptoms, uncontrolled bleeding, vomiting blood. Broken bones requiring surgery can result in as much as $10,000 in emergency care costs. If you become ill and in need of emergency care, an ambulance to take you to the hospital will start at $400 to $1,200. An air ambulance costs $2,000 to $200,000 or more. If you need tests, typical additional costs are $100 to $500. Should you need to spend the night, an additional charge of $5,000 might be added to your bill. With medications to treat your illness, the total cost of an emergency room visit could be $6,000 or more. The estimated costs for the most common reasons people visit emergency rooms. For allergies $345, acute bronchitis $595, earache $400, sore throat $525, pink eye $370, sinusitis $617, strep throat $531, upper respiratory infection $486, urinary tract infection $665. If you have a non-life-threatening condition, urgent care centers can handle it cheaper and quicker. If it's life-threatening, better you should go to an emergency room. The average cost of cancer treatment. The costs for cancer treatments in the U.S. come with a high price tag. Brain cancer treatment costs anything from $50,000 to $700,000 or more, while breast cancer costs range from $48,500 through to $300,000 or more. The price it takes to tackle pancreatic cancer starts from $31,000 through to $200,000 or more. And melanoma treatment can be anywhere from $1,700 to $152,000 or more. Bone marrow transplant cost between $638,000 and $900,000 or more. The average costs of common lab tests. An MRI scan will cost from $500 to $7,850 or more. A blood test, one of the most frequent lab tests, could be $40 up to $3,000 or more. A cholesterol test at a walk-in clinic can be $50 to $130 or more, and $40 to $75 or more for an at-home kit. An X-ray can cost between $200 but might also creep up to $3,000 or more, depending on the circumstances. The average prescription drugs cost. American healthcare prices are also high when it comes to prescription medication. If you have diabetes and need insulin, you could be facing a cost of $530 to more than $1,100 or more. A year's worth of allergy shots will set you back $600 to $2,000 or more. If you require cholesterol medication, it costs between $30 and $130. Asthma inhalers cost between $60 and $70 or more. Prescription drugs can become a big part of a patient's budget. The average cost of surgeries. Surgery costs vary drastically depending upon the procedure, hospital, location, and even type of insurance. Factors affecting the cost of surgery depend on type of surgery, inpatient or outpatient, anesthesia use, healthcare facility, U.S. region, and health insurance coverage. The cost to have surgery without insurance in the USA. The most expensive surgical procedure is the coronary artery bypass, which costs, at a minimum, $21,500 up to an astronomical $254,000 or more. Appendicitis attacks tend to come on quickly and require urgent attention, and that emergency appendectomy costs anywhere between $1,800 and $82,000 or more. Gallbladder removal costs between $8,000 to or even above $54,000. A hysterectomy starts at $8,700 but can shoot up to $40,000 or more. Cataract surgery is between $330 and $12,000 or more. That's the same as the uppermost cost of a tonsillectomy, where the lowest prices are a more reserved $790 to $12,000. The average cost of a broken bone or sprain. A hip fracture starts at $16,000 for treatment and goes up to $53,000 or more. A sprained or broken ankle could cost $300 or more if surgery is not needed. But it soon jumps to a rather more unpalatable $17,000 to $20,000 or more if a trip to the operating room is involved. A sprained or broken wrist costs $500 or more on a non-surgical basis and leaps to $7,000 to $10,000 or more if surgery is required. The physical therapy costs $120 to $350 per session. The average cost of family planning. If you require prenatal care, the average cost of a doctor's visit is between $100 and $2,000 or more per monthly visit. This adds up to a big total throughout even a single pregnancy. If you need assistance delivering your baby, this will cost anything from $2,700 up to and over $40,100. Surgery in the form of a cesarean section costs between $10,600 and $50,500 or more. A postpartum checkup costs between $100 and $3,100 or more. If you have any birth complications, this tends to cost $3,000 or more per day. The average cost of a doctor's visit. The cost of a doctor's visit depends on the type of insurance you have. If you do not have insurance, the cost of a doctor's visit is typically between $300 and $600, but prices can vary depending on several factors such as lab tests, where you seek care, and procedures done at the visit. These are the average cost of seeing different specialists if paying without insurance. Note that the price can vary depending on the factors mentioned before. A visit to a psychiatrist without health insurance can cost you $172 to $299, a pediatrician $181, a primary care doctor $203, a dermatologist $288, an obstetrician, a gynecologist $299, an ophthalmologist $327, a cardiologist $356, an orthopedic specialist $446. In addition, if you are a new patient at the doctor you are seeing, you will likely be charged a new patient fee. This is because the provider will need to do a full examination, which takes longer than a routine appointment. The estimated national average cost of a new patient office visit without insurance is $357. Thank you for watching. May you be blessed with good health.